She's been coming in for a while now, so it's very safe, very effective, very good for women throughout pregnancy. Hey everybody, it's Dr. Irwin, Kalkstein Family Chiropractic. I have Tiara in the office today. How far along are you, Tiara?
6 months.
She's 6 months pregnant. So I wanted to shoot a quick video just demonstrating how we see a lot of pregnant patients in the office for back pain to help them through their pregnancy. I want to explain how we make the tables comfortable and why it would be good for somebody to get adjusted throughout pregnancy. Why it's good for the mom and the baby, and just kind of show you the treatment we do for her. All right, so she's 6 months. So first of all, this table, I don't know if you can see this, Ash, this table drops down. Okay, so it makes it comfortable for pregnant women to lay on. Even at 6 months, you can still lay face down. Now, as she gets further along, when we start getting patients in their third trimester, we'll have them just on their side and on their back. We don't have to have them necessarily face down, but she's still okay to be face down. So she originally came in with some back pain. So, you know, a lot of times what we'll do first is we'll just kind of do some muscle work on the low back muscles. During pregnancy, your body releases hormones that cause what's called ligamentous laxity. Obviously, there's going to be some changes with your pelvic alignment, with your low back, and these hormones allow the ligaments to relax so you can carry the baby, you can deliver the baby. But because there's ligamentous laxity, some of the joints in your lumbopelvic area can misalign. Then after you have the baby, if you weren't getting adjusted during that time, once those hormones go down, the ligaments tighten back up and you can heal much more misaligned than you were. So getting adjusted throughout pregnancy would be a very good idea for not just making you more comfortable if you have back pain or neck pain, but it helps things stay in good alignment so that after you have the baby, you don't heal worse than you were. So we're just kind of getting into her QL muscles, which are these big muscles along her low back. Just a very gentle pressure and just kind of stripping those muscles out. Any adhesions or trigger points that build up, we'll focus on those. I'll just do a little bit of this now, and then I'll probably do more after the video, but just to kind of give you an idea of the things we do here in the office. So a lot of women, when they complain of low back pain, obviously, they're having more weight ventrally in the front, so there's uneven stress on their back. This is all healthy and safe for the baby and the mom, and also will help with hopefully make delivery go a lot easier. So just get a nice gentle pressure in her QL muscles, her lumbar paraspinals. And then we're going to have you sit up for me. And then I'm going to bring this piece back up, and you can go on your side facing me. So we can definitely do the side posture adjustment. This leg stay straight, this leg up. Take a nice deep breath in for me, Tiara. Exhale, good, nice and easy. Good, on the other side for me. Sorry. Deep breath in. Exhale, yeah. Very good. Face up for me. Put your knees up, then we'll adjust her neck and mid-back too. Alright, so just a regular neck adjustment like we do for anybody else. Just relax your shoulders. Good, and this one, nice and easy. Very good. Cross these arms for me, and then we're going to do the upper back adjustment. And roll back on my hand, nice and light, good. Very good. Good. There. All right, so we're going to do some more stretching and some more soft tissue work, but as far as the adjustment portion goes, and a little bit of trigger point work, that's like the basic part of her adjustment. She's been coming in for a while now, so it's very safe, very effective, very good for women throughout pregnancy. We're in the x-ray room. We have a digital x-ray system. I can shoot a film that goes right to the computer screen. It's one of the awesome features we have here at the office because it gives us a chance to see, give us a picture into the alignment of your spine and hips, pelvis. So whether it be headaches, back pain, low back pain, hip, we can see if there's an underlying misalignment in your joints. Because remember, your spine is a series of joints. It's 33 separate joints from the base of your skull down to your sacrum and your two iliums, your pelvis. Those joints are all movable in all different directions. So we just showed you the video where we adjusted the pregnant woman, and one of the things I talked about is during pregnancy, your body goes through ligamentous laxity. There's a hormone released that allows the pelvis to expand. It allows for the baby to grow, so your body can expand to carry the baby and deliver the baby. That ligamentous laxity, once you have the baby, that hormone goes away, and then the ligaments sort of tighten back up to the way they were, and you can heal misaligned. So if you come here, Ash, you can see. I don't know if you can see this. This is the low back pelvic area of a recent new patient we had that we think that she had no other low back problems before she had the baby. She had the baby about a year ago. She came in for an x-ray. She came in with low back and hip pain. This is her film. You can see how misaligned her hips are here. This would be her left side, left and right side. You can see the left side's way higher. One of the cool things about this is I have a feature where I can do I can use a vertical or a horizontal level. Oh, not that. Horizontal level. And we can see that clearly her left ilium is 25 millimeters higher than her right. Again, this is her left and right. So what happened there was probably during pregnancy we had that ligamentous laxity set in, things shifted, she wasn't getting any care, and then things healed, and they healed misaligned now. So her hips are severely out of place. That's what's giving her all the low back pain. By the way, when you're that tilted in your pelvis, you're going to put a lot of uneven stress on your low back disc space. So L4, L5, L5, S1 disc is going to be under a lot of uneven stress too. So just an example so you can see what can happen, how the low back can misalign, especially with pregnancy. So it's one of the reasons to get adjusted throughout. And even just forget that, just a regular patient. If you're having low back pain, it would behoove you to come in, get checked, even possibly get an x-ray if necessary. It's digital. I can look at this with you the second I take it. And we can see if there's an underlying misalignment there that's causing your back pain. And we can work to adjust you. We don't have to necessarily fix your x-ray alignment, in the office over time, even just a couple adjustments to get to the root cause of it. But at least you have an idea of, where your back pain's coming from. X-ray is a very powerful tool for that that we have here in the office. So low back pain, neck pain, headaches, anything like that, come in, get checked, get an x-ray, let us see what the underlying misalignment is, alignment is of your spine, and we can go from there. So again, we'd love to see you in the office. We're in Monroeville, Irwin, and North Huntington. Thank you.